Hello everyone. Today we are talking about the nervous system. So I'm going to break this down into simple a way as possible while still including all of the important information I want you to know. And then we're going to connect this to the pelvic floor and how it's related to some pelvic floor dysfunction that's pretty common. So we're going to start with thinking about the nervous system as the overarching thing that we're talking about. So we have your central nervous system and your peripheral nervous system. So central nervous system is your brain and your spinal cord, and then we have the peripheral nervous system, which is the nerves that come off of your spine or off of your brainstem and go to the other areas of your body. And so we have two categories of the nervous system. We have the somatic nervous system, which is in charge of voluntary movement, and then we have the autonomic nervous system, which is in charge of involuntary processes that are happening in your body. So for example, your heartbeat or your digestion of your stomach, those are not things that you're consciously able to turn on and off. However, we can have an effect on that. And then we have the somatic nervous system, which is like bending your elbow and using your bicep, for example. And so within the autonomic nervous system, we have two more categories. So breaking it down a little bit more, you have your sympathetic nervous system and you have your parasympathetic nervous system. And so your sympathetic nervous system, it's what most people know as their fight or flight system. And then our parasympathetic nervous system is also called the rest and digest system. So both of those fall under the category of autonomic nervous system, which means that they're unconsciously controlled. Like I said, we do have some things that we can do to help kind of shift into or out of the parasympathetic or sympathetic nervous system. But in general, you don't have conscious control of those systems. And so I wanted to talk a little bit about the vagus nerve. So the vagus nerve is coming off the brainstem, traveling down beside your esophagus and your trachea, and then through your diaphragm and into the abdominal cavity to innervate your stomach. And so that's why we call parasympathetic innervation rest or digest. So when your sympathetic nervous system is dominant, you have symptoms like increased heart rate, increased respiratory rate, we have blood pressure changes, and we have blood flow to your muscles. And the purpose of this is evolutionarily, we were getting ready to run away from a dangerous situation. Maybe it's an animal, maybe it's something that's causing danger. And when you are in your parasympathetic nervous system, those changes kind of return back to baseline. So your heart rate slows down, you're able to, relax, go to sleep, digest, eliminate. So digestion really from digesting the food that you're eating to elimination, defecating. And so the reason I bring that up is really because in your sympathetic state, you're not designed to be restful, right? So if you have an immediate stressor, let's say it's a car accident or you're in an argument with somebody, you're going to have those same sympathetic symptoms as if you were running away from a dangerous animal that's chasing you. So your body doesn't really know the difference. It just knows there is something that is stressful. I'm going to elevate those symptoms, increase muscle tension, increase heart rate. You're also getting neurotransmitters being secreted into your bloodstream, adrenaline, epinephrine. So that is what's causing those stress reactions. in a normal situation where the stress comes and goes, your body will naturally adjust and return back to a restful state or more in the parasympathetic system. If you have chronic stress, either from trauma or maybe you don't come out of the stressful situation, let's say it's chronic stress from work or a relationship, those symptoms don't go away. So you have all of those neurotransmitters still in your bloodstream, muscle tension isn't going away, blood pressure is not going away. And over time, that's not healthy. So that can also lead to things like difficulty with digestion, changes in appetite, difficulty with pleasure with sexual encounters, or things like constipation, difficulty with digestion and elimination. So what we do in pelvic floor physical therapy is we help take you, build awareness of the things that are putting you in your sympathetic state, and then giving you tools to move into a parasympathetic state where you have less muscle tension. So for example, if you are chronically stressed out or you have anxiety, you might notice pelvic floor symptoms associated with increased muscle tension, pelvic pain. When we learn to move out of the sympathetic state and into the parasympathetic state through things like diaphragmatic breathing, awareness, and different exercises, you are able to reverse those negative effects of chronic stress. Before I go, I want to bring up another topic. So we talked about rest and digest and fight or flight in terms of the parasympathetic and sympathetic nervous system. We also have, in the fight or flight category, in the sympathetic category, we also have a third option, which is freeze. So this is less commonly known. So freeze is when you are unable to take yourself out of the stressful situation or remove the stressor. So if you are not able to fight or run away, flight, the human brain tends to freeze and dissociate from the situation. So this is very common in people who experience trauma, especially in a helpless state. So when you are in that freeze state or that dissociative avoidant state, you are separating what you are feeling physically with what's happening internally to cope with what is happening. And so, for example, a lot of people who cope with their stressors through that freeze or avoidant kind of behavior tend to have diminished symptoms. So they have less pleasure, they are kind of numb to the things going on in their lives. And so in terms of the pelvic floor, this can present like lack of pleasure with sexual encounters. It can present like poor mind-body connection with turning on their muscles, for example, their pelvic floor muscles or their abdominals. I find that that's pretty common after labor and delivery, whether that's vaginal or cesarean, especially if there is if it's a very traumatic labor and delivery. And so even if you haven't delivered a baby, lots of different types of traumas can result in these similar symptoms and specifically can result in these pelvic floor symptoms. So I think it's important to understand how the nervous system affects the body and how we are able to learn based on our symptoms how our nervous system has responded in the past or how it's currently responding to whatever the situation we are in is, and be able to learn how to manage those symptoms and even reverse or reduce some of those symptoms. So let me know if you have questions, if you find this helpful. Take care.